The Hester-Davis Fall Risk Assessment is the tool utilized at Trinity Health Livonia to identify a patient's level of fall risk, categorizing patients into low, medium, or high risk for falls. Based on the patient's level of risk, interventions will be put into place to optimize patient safety. But in order to know what fall risk interventions are needed, we first need to ensure accurate scoring of the risk assessment. In this module, we'll take a closer look at the Hester-Davis. The Hester-Davis scores patients on 8 categories: last known fall, mobility, medications, mental status, toileting needs, volume and electrolytes, communication and sensory level, and behavior. Within each category, you will be presented with multiple, specifically scored items to choose from. One of the most important aspects of the Hester-Davis that you must understand is that with the exception of the first item, last known fall, all other items are designed as choose all that apply lists. For instance, taking a quick look at toileting needs, let's pretend we have a patient that is incontinent of loose, watery stool and has a condom catheter in place. In this category, our patient matches use of catheters for 1 point, incontinence for 3 points, and diarrhea for 4 points. You may think you just have to choose the highest scoring option that applies to a patient, but that is not how the Hester-Davis works. That would result in the patient earning 4 points for diarrhea, but you actually have to select all 3. So instead of only earning 4 points, this patient should earn 8 points in the toileting needs category. Make sure to choose every item that applies to your patient, not just the item that you feel fits best. Let's take a look at how to ensure accuracy in each category. We'll start with last known fall. Last known fall is the only item that does not function as a choose all that apply. It will only allow you to choose one option. So when was the patient's last known fall? How can you know? If they fell during this hospitalization, you likely got it in report and are already aware of the time frame. But if not, you can always ask the patient, or you can go to the H&P and see if anything was mentioned. If you can't find any mention of a past fall and the patient and/or family are unable to self-report, assume they have no history of falls and score a 0. The next item to assess is mobility. The options for mobility include items separated by slashes. Throughout the Hester-Davis, those slashes always mean or, not and. So the options are no limitations, dizziness or generalized weakness, immobilized or requires assist of 1 person, uses an assistive device or requires the assist of 2 people, and hemiplegic, paraplegic, or quadriplegic. Dizziness or generalized weakness can be patient-reported or identified during assessment. The mobility status is something that you will identify with the BMAT and TUG assessments, which will help you identify the level of assistance to mobilize this patient. Immobilized means the patient has decreased or limited movement, and this can be related to restraints, C-collars, traction, chemical sedations, etc. Or it could be related to weakness or paralysis. But often people only think of weakness-related immobility and don't identify the things that we've done that may immobilize a patient. Use of assistive device is also identified in the BMAT, but anything from using a cane or walker all the way up to patient lifts would count for 3 points. The 4-point item is also easily assessed, so this item can mostly be determined with bedside assessment. Remember to choose all the items that apply to your patient. Someone that uses a walker and requires 1-person assistance wouldn't just score 3. They would score 2 points for the 1-person assist and another 3 points for the use of the walker, giving them a total of 5 points on this item. Medications is the next item to address. The medications we need to know about are cardiovascular, central nervous system, diuretics, and chemotherapy drugs. Cardiovascular meds are any medication that lowers blood pressure or reduces cardiac load. This includes beta blockers, calcium channel blockers, ACE inhibitors, antiarrhythmics, vasodilators, etc. Central nervous system meds include medications that alter the nervous system, like benzos, opioids, muscle relaxers, seizure medications, sedatives, antidepressants, etc. Diuretics increase the amount of water and salt expelled through urine, so Lasix, Bumex, etc. And chemotherapy drugs are pretty self-explanatory and closely watched in those patients receiving them. When making selections for this item, with the exception of the chemotherapy medication, that it does specify are taken within the last month, all other medication-related points are for medications taken within the last 24 hours. For new admits, ask the patient for a med list, and for reassessments, look in the MAR for accurate medication information. Pay attention to the 1 and 2 point items. 1 is cardiovascular or central nervous system meds, and 2 is cardiovascular and central nervous system meds. This is still a choose all that apply item, but it is not appropriate to choose both the 1 and 2 point item for this same patient, as selecting one makes the other non-applicable. Next, we'll look at mental status. A mostly straightforward list. Remember that the patient may meet criteria for more than one option, and remember that the slashes between descriptors always mean or. Even though the 2 point item says lethargic / oriented to person only, that doesn't mean they need to meet both of those criteria to earn the 2 points. It's at least one of them, so you could have a patient that is oriented to both person and place, earning 1 point, and that patient is also lethargic, which would earn them an additional 2 points. The fact that they're more oriented than person only does not mean that you can't choose the 2 point item due to the lethargy alone. The 4 point item of unresponsive noncompliance with instructions requires some clarification as well. The noncompliance for this item must be related to cognitive deficits, not behavior. We'll address behavior in a later category. Ensure you've awarded your patients all the points that they deserve before moving on. The 5th category is toileting needs. Toileting needs is another mostly straightforward category. Some definitions that might help you as you assess the patient are diversion devices, which for urine include external catheters like the PureWick and the Condom Cath, and for stool include fecal management systems like the Flexaseal, or ostomies. Assistive devices include things like bedpans and bedside commodes. The 4 point item, again with the slashes indicating multiple descriptors, only needs to meet one of the 3 choices. It could be diarrhea, or frequency or urgency of urine or stool. Doesn't necessarily have to relate to the diarrhea. Let's move on to volume and electrolyte status. This category does have some confusion with the scoring. The 1 point item, NPO greater than 24 hours. That means the patient has been NPO for greater than 24 hours already, not that they have an order placed that will exceed 24 hours. The NPO could be due to an order, or because they have not eaten in 24 hours related to sickness. The 2 point item, use of IV fluids or tube feedings, is worth looking at as well. This is more all-encompassing than people realize. IV fluids in this sense include anything given through the IV that is not an IV push medication. So it includes continuous fluids like normal saline. But if they are receiving any IV medication, even including continuous IV medications like heparin or IV piggyback medications like antibiotics, all of these things should be included in the 2 point item. Nausea and vomiting for 3 points is pretty self-explanatory, as is low blood sugar for 4 points, but specifics are necessary for the electrolyte imbalances descriptor. If in the past 24 hours the patient has had any lab values outside normal limits for calcium, chloride, magnesium, phosphorus, potassium, or sodium, they will earn 4 points in this category. You may have to review the patient's labs to ensure accuracy of this item. Communication and sensory is next. Another item that is mostly straightforward but could be helped by some definitions. For 1 point, in parentheses, it says glasses, which is the easiest way to identify pre-existing visual deficit, but the problem does not need to be corrected. So they could have visual or hearing deficit without having glasses or hearing aids. They earn 1 point with or without correction. For 2 points, non-English speaking or patients unable to speak are easy assessments to make. Slurred speech is a bit of an oversimplification of the problem. You're looking for dysarthria, which is an overall difficulty pronouncing words, not just slurring words. It's more than that. If your patient struggles at all with the pronunciation of words, they'll earn 2 points for their slurred speech. Again, it's very common for patients to score on multiple items within this category, so don't limit yourself to choosing only one. Finally, our last category is behavior. Again, it's useful to dig into this with some definitions. Depression or anxiety will earn 1 point. This includes any history of these disorders, medicated or not, so you could look in the patient's history, or ask them. The 2 point item is noncompliance for behavioral reasons. Back in mental health category, we scored for noncompliance related to the cognitive deficit, so try to understand the reason for the noncompliance to ensure the scoring is appropriate. The 3 point item is ethanol or substance abuse. Again, we're looking for any history of, not just current abuse. Ask the patient or look in the history to ascertain the information. And the 4 point item is for impulsiveness. Epic will then total out your score for the patient. It automatically adds points based on the patient's age, so the score may be higher than just totaling the points you assigned in your assessment. The total score will determine the patient's fall risk level, and ultimately the interventions required to have in place for that patient. A score of 7 to 10 is low risk, 11 to 14 is moderate, and 15 or higher is high risk. Based on that identified risk level, follow the fall prevention bundle to identify the required interventions that will maximize patient safety related to falls. These are all nurse-driven interventions and do not require any physician orders to be placed. Also keep in mind these are the minimum interventions required for that risk level. If you feel that your patient would benefit from some of the higher level interventions, you can put those in place. For instance, if you have a patient that is scoring a low fall risk, but is uncontrolled on Coumadin with an elevated INR, you can choose to put fall mats in place for that patient. Even though they are considered a medium risk intervention, their use with this low risk patient would be appropriate because of the patient's risk for injury from fall related to clotting factors. You can always choose to incorporate higher level interventions when you find it necessary, but it is never appropriate to choose to implement less interventions than the fall risk bundle dictates for a specific fall risk level. You will likely find this chart posted on your units, but it is also available on the Trinity Livonia SharePoint page. When you open Microsoft Edge, you'll be taken to the SharePoint homepage. In the search box, type Livonia Education. Then, when you are on the Livonia Education page, choose Nursing Resources. Open the Fall Prevention folder and choose Standard Work for Fall Prevention, and the table will open on the desktop. From here, you'll be able to view or print your resource.